Welcome to the Uncommon Living podcast, where we host dialogues in the science, experience, and practical wisdom that build physiological and psychological resilience. My name is Thomas Seager. I'm an associate professor in the School of Sustainable Engineering at Arizona State University and the CEO of the Morosco Forge Ice Bath Company. My guest today is a woman who is the mother of triplets. Two of her children, the boys, are diagnosed with autism spectrum disorder and suffered a neurological regression when they were 2 years old. The third, her daughter, doesn't have an ASD diagnosis, but she experiences seizures. This woman also works as a physician's assistant, and everything that she researched about how to treat and recover some of the neurological functions that her children lost pointed to mitochondrial therapies. She's been so successful that one of her boys has lost his diagnosis, and the other one, she says, barely meets the diagnostic criteria. In this conversation, we're going to talk about the nutritional support that has helped their mitochondria recover and their brains develop. Nicole Rincon, it is a pleasure to meet you. Thanks for joining me here on the Uncommon Living podcast, because you were telling me about your experience as the mother of triplets and as a medical professional who takes a metabolic approach targeting mitochondria with therapies to treat autism. Welcome to Uncommon Living.
Thank you. Thanks for having me.
Will you tell me about the neurological regression that your children experienced?
Yeah, so that's obviously, it's a long story, so it'll take me a few minutes here. Just to back up, so I have triplets. They're now 13 years old, and I'm a physician assistant. I've been practicing medicine for 18 years. I've been treating autism now for 9 years. And I got into this field because my children, I have 2 boys and a girl. Both of my boys were diagnosed with autism after regressing at age 2. And my daughter actually started having seizures at that same time, around 2 years old. So it really started, my story, I've thought a lot about my story and just how did this happen? How did I get here? Really, what were the preceding steps? Personally, I had some fertility issues. Everybody always asks because of triplets. So I had PCOS. Wasn't ovulating properly, but all of my other metabolic markers were very normal. I didn't have insulin resistance or diabetes or anything. My weight was normal. So we did some fertility treatments, and the Clomid didn't work. I ended up doing the injections with what's called IUI. And I got pregnant on the second try, and unfortunately I had a miscarriage about early on, like 6 weeks on. And then the third time, my husband and I, we said, this is the last time, because fertility treatments, that's a whole nother podcast, and it is very stressful and very terrible, especially for marriages and just emotionally. So last time, we're going to try, third time's a charm. And we did. We got pregnant. I got 3 babies. They actually asked me, do you want to do selective reduction with your babies, basically removing one of the babies? I said, no, absolutely not. That's definitely not my life journey and not what I believe in. So we had the babies, and I had bed rest. The pregnancy was very difficult. The first trimester was pretty good. I was exercising, feeling pretty good. The second trimester, I kind of started to have some bleeding, a little bit of premature contractions. I was put on progesterone, on bed rest. So essentially for me, I was laying down for the last 20 weeks of my pregnancy and indoors, and air conditioning and blue light and all that. But I tried to take my supplements. I really, I tried to eat well. I didn't take any medications, no Tylenol, no drugs, nothing. I refused it all. So they were born at 34 weeks. And when they were born, there was some feeding problems. My one son did have, he had to be intubated for 24 hours. They just said due to premature lung development. So they were there 2 weeks total, and just mostly for feeding difficulties. There really wasn't anything severe that we found. And so we brought him home, and I'm a PA, so Miss Scientist. I was weighing him every week on this little bucket container I had in my kitchen, and literally tracking their weights and their graphs and their milestones. I mean, I was a maniac and monitoring their food. We did have, so my one son in particular had Ryan. He had some reflux and some allergies that kind of, now looking back, that was a red flag. But basically, they were hitting all their milestones, developing totally normally. And then it was about a year and a half that Ryan, I noticed it was very strange. He regressed a little. Maybe his speech dipped down a little. It was nothing severe, but he actually presented as tremors. And he'd wake up in the morning and he'd eat with his little fingers and trying to use his spoons, and he'd shake. And I thought, well, that's really weird. And baby shouldn't be shaking. So I went to the neurologist, and we're starting to get this workup. And they said, well, he may actually have autism. There's some decreased eye contact. And I thought, well, that's odd. It was very slow. So we were doing this whole workup for my son, but everybody else was progressing, and even he was progressing. And then at around 24 months in the summer, I noticed that it was pretty quick. It was like 2 weeks. My other son, who had been completely on target, in 95th percentile weight and height, he basically stopped eating. He started with horrible diarrhea, and he basically would start spinning in the circles in rooms, stop making eye contact, stop speech. I mean, this happened over a course of 2 weeks. I mean, complete regression of skills. He had over 50 words. And I couldn't believe it was happening. I mean, I lost him. He wouldn't even hug me anymore. I tried to get close to him. He'd scream, just a lot of screaming. And then I noticed my daughter at the same time. She was waking up in the mornings, and she would just have seizures. It was absence. It was a very clear clinical picture. She would stare off, and she'd start smacking her lips. And you couldn't bring her out of it for about 30 seconds. And this was all happening at the same time. And we were working up my other son at the time. And, so basically we rushed to the pediatrician. They said, this is autism. This is what autism looks like. Now you have 2 boys with autism. Your daughter's having seizures. And I get chills thinking about it. It was such a haze. It was so surreal. It was surreal. I mean, even now it feels like a bad dream, nightmare, like, did that really happen? And I was just, my husband and I, we were kind of in disbelief, fumbling around. They sent us to a neurologist. And the neurologist, the one thing he did do that I now agree with, he said, well, let's get a 24-hour EEG. Let's see if your son's having seizures. Maybe that's causing a regression. We did a hospital night stay. It was normal. And then he came back and said, look, this is just autism. Here's your risperidone. It'll stop the spinning in circles and, calm him down. And that's it. You get an anti-dopamine agent, and this is your son. He's going to be disabled for life. And this is what I was told at age 2. And I'm like, what, something happened? I mean, he was developing normally. Like, what happened? And everybody shrugs. The pediatrician shrugs, the neurologist shrugs. And I was so dumbfounded, because I had been in the Western medicine world. I was a physician assistant for a decade prior. I'm like, this is it. This is the be all end all for medicine. Like, how can this be? So it really completely upturned my life view of medicine, the world, health. I mean, I knew the importance of nutrition, but I just had no idea how far back we were in the Stone Age as far as some of these neurologic, diagnoses. So anyway, I started doing research on my own, like most autism moms. I mean, I'm like, I got to figure this out. There's got to be something. I don't accept this. Like, absolutely not. I didn't put him on the medication. I stomped out of there. Like, this is not right. I'm a mom, and I'm a PA. So I did all the research up until 2-3 o'clock in the morning. And, I stumbled across omega-3 fatty acids, helping with autism and apraxia. And I got the Speak variety where it has the vitamin E integrated into it. So I said, well, what's it going to hurt? Let's start it. And I started it. And within like a week, my son stopped spinning. He calmed way down. His eye contact, he started looking at me again. He stopped. He was at the time hitting his head against the wall. He was headbanging, and he stopped. And that just completely took that behavior away permanently. Thank God.
And this was from omega-3 fatty acids, but did you discontinue the anti-dopamine drug?
We never started it. Never started.
Okay, gotcha. Yeah.
Yeah, I didn't. I was like, this doesn't make sense. No,
Yep.
Like, we're not putting him in an antipsychotic. He is not psychotic. And,
Agreed.
and I did, research. Dopamine, you need dopamine for brain neuronal growth. I'm like, we're going to stunt him for life if I do
Yep.
what you tell him.
And we know that omega-3 fatty acids are also essential for brain development.
Oh, absolutely. The DHA. I mean, we actually, for a little while, we were on a little bit of that pediatric dose when they were a year old. And we were on vitamin D and DHA, or I'm sorry, DHA, for the brain growth from the pediatrician, which was a great idea. Maybe that prevented some of the regression. I don't know, to begin with. But we stopped it at a year because we were told we didn't need it and they were developing normally. So yeah, so basically we started it, and yeah, I mean, and I had this intuitive sense that there was just this ton of inflammation because, you know, I could tell his brain was hurting him. He kept hitting it. He would turn really red. He just seemed like he was in pain. There was just a sense of a mom intuition, like this is inflammatory in nature. I mean, amongst other things, but I thought the omega-3, okay, good. I know this from supplementation. So even in adults, right? There's a lot of literature. It helps. So we started it. It helped. And, you know, we got no speech back. The social was still not there, but I thought I'm on the right track. Okay. And so that encouraged me to dive even further. And what do I need to do now? And I systematically started adding things in. You know, we started a multivitamin at the time with B vitamins called Vita Spectrum. I started N-acetylcysteine for the sulfur because I knew that I was like, well, he took a ton of Tylenol with his vaccines. So I'm like, we got to get that Tylenol out. You know, I have to help his liver. So I just kind of made my own little protocol from what I was piecing together from my medical knowledge and what I was reading online. The other big component was the diet. I really took a deep dive, and all the seed oils. I mean, at the time we were eating Trader Joe's canola oil as our mainstay oil. Yeah, should have known better. So, you know, I replaced all the oils. You know, we started using ghee mostly for cooking, you know, the clarified butter. So everything I did, I felt like it was getting us little tiny gains. And, you know, and then the other big thing that we did, which I knew they were yeasty. I could tell they had like a fungal overgrowth, because they were getting diaper rash and things like, you know, kind of the red ring around the anus that the kids get sometimes with fungus. So I treated him with grapefruit seed extracts. And man, that really helped with all the hyperactivity. The stimming just went way down. And we ended up going on nystatin, which is an antifungal, for almost 2 years because it really helped their behavior for my kids particularly. So in either case, so we started adding in things. And of course, we can get into everything I added. But at when they were about 4, like 2 years later, I said, okay, I need to do this officially. This is just, I'm piecing this together. I'm making progress. So I went to MAPS, which is the Medical Academy of Pediatric Special Needs, founded by Dr. Rosignol, but Dr. Fry is a part of it. And there's a bunch of brilliant clinicians and researchers. And they put on a training education conference for how to treat autism, you know, for medical providers. So I went to that and went to all the classes, and I met Dr. Rosignol there because I stomped up to him. And my first day there, and I said, who's the guy? Who's the boss? And they said, oh, that guy. And I said, I just walked up to him. I said, look, please hire me. I'm a PA. He's just like, who are you? I'm like, you're going to hire me, please. Like, really, I'm going to do a great job. I trust me. And he did. He hired me on the spot. I mean, he's like, do you have a resume? Are you licensed? So, but I did. I started working then. I started working like a week later, and I've been doing it ever since, because I just knew I wanted to help my family. I wanted to help other families. And now I'm here, you know, to really spread the word. And I appreciate guys like you who are just trying to help out, because we need a team. We need a bunch of people saying, hey, this is treatable. I mean, this is something we can do. That is my main message. Like, we got to do something. You can do something.
Autism Acceptance Month. What a crock of crap that is. I'm not ready to accept, and neither were you. Yeah. But there's now a lot of conversational threads that we can go. And I'm anticipating that the audience is going to be curious about several things. Yeah. You said that you used Tylenol with the vaccines. Yeah. And the only reason I can think of to use Tylenol or acetaminophen is because they were having a vaccine reaction like a fever. Did that happen with your children? Yeah. I mean, they just got grumpy after they got their vaccines. They'd be irritable, they'd cry, they'd get tiny fevers, and, we were just taught in Western medicine. I went through PA school. I mean, in some ways it was the worst thing that happened to me, because yes. I'm like, oh, Tylenol's safe. So that's fine. We'll give it to them like water, because that was what I was taught.
And so, yes, they had some small reactions to the vaccines, and we would load them up on Tylenol. And I do think that I think the Tylenol was definitely a part of the equation. I don't know how much. I will never know how much.
We know that the Tylenol has to be processed in the liver, and that one of the intermediary steps of that processing is toxic to the liver, that it will deplete, if I'm remembering this correctly, glutathione from the liver. And in particular, babies, infants are more vulnerable to this toxicity than adults. Parents are not told this. Parents are not told that if their child has a fever in reaction to a vaccine, which is very normal, very ordinary, that giving them Tylenol will poison their liver. And so, as you said, you're even instructed that Tylenol is safe. Are there neurological aspects to Tylenol or acetaminophen? Because we're aware of the liver and that toxicity, but I'm not aware of how it might impact the brain.
That's a really good question, and I'm not by any expert, a Tylenol expert, but I do know that the glutathione has been shown to be statistically low in kids with autism. So,
Correct.
I mean, if you think about as the master antioxidant of the body, which glutathione is, they're already compromised. They already have, this oxidative stress burden higher than most kids have, and so taking away their ability to detox will likely cause this storm of oxidative stress that can trigger it. So, and I was going to talk about this at my next talk. Actually, it's your conference there, but there's a storm. There's kind of a trilogy of inflammation, oxidative stress, and then immune function that seems to go together to all crush the mitochondria at a very key developmental time. So, when you seem to, with the immune injuries, maybe from the vaccination, but certainly taking that Tylenol, and that basically decreases your body's ability to deal with the oxidative stress, that reactive oxygen. It snowballs, and it snowballs into itself, and then the inflammation, and then you get mitochondrial dysfunction and regression. And I think absolutely that was the picture of my children. They're kind of the textbook picture of that because of the severe regression. And so I know absolutely without a doubt we have mitochondrial issues, and I've tested them. So, optimizing that for my kids and for a lot of these kids is really helpful. So I don't know, to answer your question, I don't know how it affects the brain per se, but we know that combo can cause neurodevelopmental regression due to the mitochondrial dysfunction, downstream effect.
The pathway by which acetaminophen could impact the brain is by the depletion of glutathione, because glutathione is essential to support mitochondrial function.
Exactly.
Without that support, especially at a time when the child has a fever, which is a mitochondrial event, without that glutathione support, it is entirely plausible that the mitochondria become impaired. And that impairment reorients their neurological development, especially if they're experiencing inflammation. It could be in the brain or throughout the body as a response to the vaccine. This could initiate the onset of neurological regression, or the stereotypical behaviors of autism, by acting through the mitochondria, if not directly on the brain.
Exactly.
That's really helpful. But your children did not regress in some dramatic fashion in response to a vaccine injury. The way that you're describing it, their regression sort of unfolded over weeks or months. Will you tell us more about that?
Yeah, that's a really good point, because I've thought obviously a lot about this too. And I think there was a lot loading our particular gun. So I think, I had some maternal toxins on board. I think I had folate receptor antibodies. So I think they lacked folate to begin with. And we, at the time, I think we have some susceptibilities to copper toxicity versus the zinc ratio, because it was very interesting. Even developmentally, they had red hair, my son and my daughter, and we have no red hair. I mean, I'm Italian in origin. My husband's like Mexican, right? So we're both like really dark haired. And I thought, why do our kids have red hair? So I think they were copper toxic. We lived in a house with copper pipes, and we weren't filtering the water properly. So I think that helped, that loaded some of the gun. I think obviously it was the diet and the inflammatory oils. But what I think another piece of that picture too, I mean, we talked about the Tylenol, potentially vaccines, but at the time we had a water leak in our house. We lived in San Diego. And I really think that was part of it, because I was thinking, what happened at that summer? That summer, it all fell apart. And it turned out in our downstairs bathroom, there was a squishy part of the drywall. And I was like, oh, what's happening? So we busted open the wall, and there'd been a chronic water leak that had gotten worse. And I'm sure there was just a ton of black mold behind there.
Yep.
And we didn't do anything proper to remediate it. We didn't call. We had to do it under the table because we were poor and we were young. And
Yep.
so, we tried to do it ourselves. We lived in the house while we're just opening up these black mold walls. And that was when they regressed. And I thought nothing of it because I didn't know how dangerous mold and mycotoxins can be. And I think that seemed to be the tipping point. And then we actually did the remediation eventually, covered it up. And then I went down this rabbit hole. And once we kind of stopped the water leak and treated the fungus and supported their liver with the NAC and the anti-inflammatories from the omegas and things, they got a lot better. But again, it really, and this is kind of downstream, but the speech didn't come back. It took 2 years, and we didn't really get it back till we optimized the mito. So when I started to add in the CoQ10, the leucovorin, the carnitine, the PQQ, all of these mitochondrial supplements, that's when I noticed my son started speaking again. So there were things that, we needed to kind of do it all. I needed to stop the injury, stop the inflammation, help the liver, but then help the mito. And, it was just this progression that kind of led to where we were, where we are. So.
One of the things that came out in the recent MAHA report, make children healthy again.
Right.
I think there were 4 categories in that report. And one of them was the state of metabolic health of children in the United States is abysmal, and it seems to be getting worse. Another was the accumulation of environmental insults. So these are toxins. It could be copper. It could be black mold. It could be any number of other things that place burden on the body. The combination of these two is particularly pernicious. That is, the mitochondria help defend the body against those environmental insults. When the mitochondria are high functioning, the body is resilient. It can accept a lot of damage. It can even respond to that toxicity as if it were a hormetic stressor, building up its capacity, strengthening the body through the energy provided by the mitochondria to come out stronger. But when the mitochondria are already impaired or dysfunctional, the additional insults can push the body over the edge because the body's fragile rather than resilient. And it sounds like some combination, some total load was placed upon your children at a time when their mitochondria weren't getting the support that they needed.
Yeah. At that critical developmental period of that 18 months, 2 year, that seems to be, there is that regression window that is very typical when the mitochondrial needs actually increase. I mean, you need a lot of energy for neurologic development at that time. So, and then when the increased stress and then increased demand, and it crashes. I mean, it's absolutely, you're totally right. And I don't think it was one particular thing. And I don't think it often is in my patients. It's usually a combination of many insults. And it can be different for different patients as well. I've seen it with pesticides. Sometimes we test them, or phthalates have been shown. The BPAs have been shown to increase autism rates. I mean, there's a lot of air pollution, 2.5 ppm, air pollution. So it all adds up into a soup of mitochondrial injury, like you said.
There are a number of theories on the causes of autism, whether it's microplastics or vaccines or PM 2.5 in the air. Like, people have their sort of pet oversimplified theories. Mold is a big one right now. And the one thing that unifies all of them, that integrates all of them without the risk of oversimplification, is the realization that they all act through the mitochondria. They all damage the mitochondrial DNA or otherwise impair the normal mitochondrial function that control neurological development. So we got to talk about mitochondria and the brain. How do mitochondria participate in the formation of neurons, the growth of the brain, like the typical trajectory of neurological development. We know that they produce ATP, but
Right.
it's more than that. Will you tell
Yeah.
us?
So, like I said, this is a good question for Dr. Fry because he's the PhD and not me. I mean, my job, like I said, as a clinician, is to optimize the mitochondria, is to look at the different mechanisms in which we know that they need support. So you need the front loading as far as folate, and you need B12. You need to stimulate and make sure that that Krebs cycle is running properly. You need to make sure the electron transport chain is working properly to spit out the ATP. And there's different things that we can do to optimize them. Different supplements, different testing. And the trials are really interesting to show that, I mean, there's a ton of data that shows that it helps with functioning. Like I said, I'm no PhD, so I'm going to let Fry talk more about the exact specifics of it, because I don't want to overspeak or overshare. But as a mom and a clinician, it absolutely potent, and it's been my observation with myself and my patients, and it is absolutely critical, like you said, for and even in adults too, with fatigue, chronic fatigue syndrome, fibromyalgia. I mean, we see that this is not a thing specific for autism, Alzheimer's disease, Parkinson's disorder. I mean, if you're optimizing mitochondria, a lot of these things can resolve or improve at least. So it is all about the mitochondria, and they're so vulnerable because they're outside of the nucleus, and they're vulnerable to all these reactive oxygen and this oxidative stress and inflammation. So they're just the essential, and they're vulnerable, and so at the same time we really need to protect them to optimize neuron growth. But yeah.
Most people are familiar. If they get this far through a podcast, it's because they're familiar with the role that mitochondria play in metabolism. They
Yeah.
know that it is mitochondria that will take what's in the bloodstream, the free fatty acids or the glucose, and through respiration, combined with oxygen, produce ATP to fuel all the processes in them, or almost all, whether that's wound repair or growth or just the energy, muscle movement, even thinking is powered by mitochondria.
Yeah.
What people often don't realize is that mitochondria play an essential role in signaling apoptosis. So this is the removal of a cell.
Yeah.
And that is extraordinarily important in the development of the brain, because the brain develops in these waves in which there's lots of neurons that form and they all become connected, and then they are pruned. They are selectively pruned so that the brain is optimized for the functions that the child is going to need later on. That is, certain connections, certain neural connections are supposed to be dominant, and other ones are removed. It is the mitochondria that steer that control that growth and pruning, which is it's sort of extra metabolic. It is an additional signaling function that the mitochondria control, not just the production of ATP. And so we might surmise that when the mitochondria are not operating in a typical fashion, that signaling function that controls the trajectory of neurological development at the subcellular level is also atypical. And now, is it any surprise that a child might experience sensory processing issues when their neural connections are wired differently or atypically, when things are connected that ordinarily wouldn't be connected? We can understand how there would be sort of sensory noise in what would otherwise be ordinary processing of those signals.
Well, and on that point, I mean, it's increased head circumference, it especially accelerated head growth at that 1 to 2 year phase. I actually believe it's like 6 months to 18 months, but that accelerated head growth is correlated with autism as well. So it kind of lends to your theory that there's decreased neuronal pruning, like literally the brain is growing too much, and that there's not, that we see these large heads in kids with more severe forms of autism. And to that other end, we actually see kids on the opposite end of the spectrum as well with microcephaly. And they've correlated that with low folate in the brain, which is another problem found in autism, which is the folate receptor antibodies and cerebral folate deficiency. So sometimes by looking at doing a physical exam, does he have a big head or a small head or a normal size head? We can almost kind of see what happened during the growth. And obviously that's only one correlate, but you're absolutely right. There is that portion. And my son anecdotally that regressed the most severely. He had a very large head circumference, and I saw that with him. So, and he does tend to have at this point more sensory processing issues than my other two ever did. So
let's go back to the diarrhea, and also you said that your children were very yeasty. It suggests that there were gastrointestinal abnormalities. I don't really know what the right word is, but that their gut microbiome was not operating in a way that would support their brain. We know the gut and the brain, they have to work together.
Right.
What do you know about the relationship between the gut and the function of mitochondria?
So that's obviously, a complicated question, and there's a lot. So with my kids, I always wonder if it was the chicken or the egg, because, did my children, because their stools were relatively normal. As kids, they had some milk intolerance, and that was a red flag. But I mean, they were nothing like they were when they regressed. And it was a sudden change in bowels, like where they were formed, and then they were really foul smelling and loose, to the point where, like I said, my son didn't want to have them on his body. He'd smear it because I could tell it just bothered him. And so, did he get a dysbiosis from the acute mold exposure, and then that crashed his mitochondria, crashed his neurologic health? Or was it the opposite? Was it the actual toxins crashing his mitochondria that overburdened his GI system and caused that? Or did it just feed on itself? Like the terrible trio we talked about, was it the immune plus the oxidative stress, plus the inflammation all at one time? And, it seemed to spiral, and that was my case. So, so the intermediates, your gut bugs produce a ton of vitamins and nutrients for your mitochondria in general. And if they're throwing off a lot of toxic components, they can be very neurotoxic for what's coming out of your gut. So like the big classic one for autism is Clostridia overgrowth with propionic acid. Propionic acid, it a little bit can stress the neurons and actually cause some, like you said, some actual helpful physiologic stress, but at a high level, propionic acid overburdens and prevents mitochondrial, cells from functioning properly. So we want that butyrate. So kids normally there's these free fatty acids in the gut, and there's the main ones are acetate, propionate, and butyrate. So these kids are statistically shown to have low butyrate and high propionate, which in and of itself causes mitochondrial dysfunction. So they're already set up through their microbiome to have these metabolic problems. And like you said, the question is, I don't know which one came first. I don't know, did the gut come first or both? I don't know. Certainly, even some of the microbiome can be tested in utero. There's some really crazy ways they can do that and find that it's abnormal. So it may actually be the microbiome coming first, or contributing at least, that stresses the mitochondria, that gives this negative feedback loop. But yes, cleaning up the gut is, in my personal experience, in my clinical experience, I'm always looking at the gut. I mean, before we try and optimize mito, you really want to look and make sure that there's not any significant dysbioses, because it's going to be hard to make gains, even with mitochondrial support, if you're just constantly crushing it with toxic substances from your gut. And propionic acid is just one of them. There's many fungal metabolites. There's many other bacterial metabolites like LPSs, those inflammatory lipopolysaccharides from gram-negative bacteria. So there's a ton we can talk about there that cause inflammation and reactive oxygen. But so it's a big treating the gut can be a big game changer for autism. Absolutely.
The gut is upstream of mitochondria when it comes to metabolism. So metabolism is not just one thing. It's not just sort of the Krebs cycle inside the mitochondria. It is the gut that produces the metabolic substrates that the mitochondria use. And you mentioned propionic acid. Mm-hmm. The gut production is controlled by the gut microbiome. Yeah. Most of the DNA on which our body relies isn't even ours. There are so many different organisms in our microbiome, and in particular in the gut, and we're relying on it to digest the foods that we eat and produce the things that our mitochondria can actually use. One of them is the propionic acid. Yeah. And when the gut microbiome is out of whack, it can produce too much propionic acid. Yeah. What's really interesting about propionic acid is that it is used in animal models to induce autism. So
Yeah.
when a researcher wants to use mice or rats or something, and they want to study autism and they need to create autism in the animal,
Yeah.
they administer propionic acid, which
Mhm.
you know is, at least in the concentrations used in the lab, a mitochondrial toxin.
Mhm.
When the gut is wrong, that is, when it's producing too much of the wrong free fatty acids, too much propionic acid, is it any wonder that the child's brain experiences the same kind of phenomena, the same kind of characteristic response that the animal's brain in the lab is experiencing when they're sort of overdosed with propionic acid? Of course, there is a relationship between the gut and the brain, but in particular, this relationship goes through the mitochondria. And
Mhm.
so part of the sort of portfolio of theories that we can apply to the origins of autism must include the gut, when we realize that the mechanism is through the mitochondria, and why things like gut microbiome transplants, fecal transplants, or whatever they're called now, altering the gut microbiome can result in improvements
Yeah.
in the stereotypical autistic behaviors.
Yeah. Yeah, it's fascinating, the fecal microbial transplant studies. I mean, there's really some good literature. I have a lot of patients that do it in Mexico or go do it elsewhere because it's not legal yet in the U.S. to do, but except under clinical trials. But a lot of parents have a lot of gains, and I mean, there's definitely, and it's interesting though. A lot of them say that it helps for about 6 months, and then some of the gains are lost, and that's what they find. And so it's interesting why they don't stick. Is it because there's some kind of retained memory, maybe in our appendix that gives us our microbiome that keeps chronically donating it, or is there some metabolic issue, like you said, that's kind of steering the microbiome into a certain pattern because of either diet or toxins on board that kind of manipulate the microbiome? And so
Maybe that the conditions which created that altered gut microbiome in the first place
yeah.
persist
Yeah.
even after the transplant, or
Yeah.
or they might be transient and then come back at some point in the next 6 months
Yeah.
and re-alter the gut microbiome. And
Yep.
at least if that's the case, it would totally make sense and be consistent with what these parents are experiencing.
Yeah.
There's something else to bring up, and it might be difficult to talk about, but I want to go back to your fertility issues
Yeah.
and the PCOS.
Yeah.
Okay. We know that conception and pregnancy are metabolically demanding. And you said, look, I didn't have insulin resistance. I had PCOS, but I didn't have other markers of metabolic dysfunction.
Right.
And I'm going to sound argumentative like a jerk, but
I
PCOS
can feel it
is
coming.
yeah, it is a marker of metabolic dysfunction. It's strongly associated with insulin resistance. And even if you didn't see that at the time, it could be that you were fine on a glucose tolerance test or,
Yeah.
or some other test really looking for type 2 diabetes or pre-diabetes. It may be that you were fine on an HbA1c, the measure of your hemoglobin and the extent to which you had experienced prior blood glucose spikes.
Yeah.
But underneath these sort of clinical markers or these diagnostic thresholds, the PCOS is typically an indication that you are suffering from some kind of mitochondrial impairment.
Oh, yes.
Okay, you're nodding, which makes me feel like I'm not offending you.
No, I mean, this has been, because you can't dive into your kids' health without diving into your own, right?
True.
So this has been part and parcel of unpacking all of this. And I've learned so much along the way about my own health. And really, the thing with my PCOS and my health is that it really does tend to fluctuate, just like my kids and a lot of people's health. And I really have looked at why and what. And honestly, for me, it's really been associated with, because I've actually had, before that, I've had positive ANA. So like rheumatoid arthritis has kind of been bounced around as a diagnosis for me as well. And so I know I have inflammation, but when I clean up the diet, specifically grains, when I take grains out of my diet, it goes away. And like my acne goes away, I mean, metabolically, I feel better. I start adding in wheat and corn and all the grain. And I notice that I'm more tired. I don't sleep as well. So it very much fluctuates. And so yeah, no, I'm not offended. I think depending on, I've gone through periods of high exercise in my life where I've been really, working out 6 days a week, and then sometimes that a drop off and whatnot as life happens. So a lot of it fluctuates. And I think, I was definitely doing exercise, but I was not eating what I would have eaten now. Like if I'd had a do-over, I'd do it all over, totally differently, And I've now dialed in my diet to know, okay, I don't eat grains. I like, the red meat. I mean, I did carnivore for a while. It was great. That's a whole nother discussion. But I found that it was my thyroid was actually tanking due to the low carbs. So I actually added in some fruits and vegetables, and that seemed to really help stabilize my microbiome. And, everybody's a little different. But anyway, yes, you are right. My hemoglobin A1C last time was 5.2. So, I mean, I don't think, I don't think I have insulin resistance. And yet I do remember when I was in PA school, I think it's tied to stress as well. And I don't think that we can underplay, especially for females. I mean, I'm in a demanding career. I was top of my class in PA school. I was the youngest PA in my graduating class. I'm kind of a overachiever. And I remember I was doing an endocrinology rotation at 23 years old. And the endocrinologist looked at it, and she looked at my arm, and I have these little creases. She's like, "You have insulin resistance." And I'm like, "What?" And she's like, "Yeah, look at the crease on your arm." I'm like, "I work out 6 days a week. I'm like, 120 pounds. She's like, "Well, I don't know, but that's what that is." And I just kind of thought, that's interesting. And so anyway, I knew there were signs, and I knew that there were things. And so optimizing my diet really helped. But I didn't know that at the time before I got pregnant. So
there's something more to this. It's going to lead us to cold exposure. You know that I've founded an ice bath company called Morose Coforge. I'm also an engineering professor in the School of Sustainable Engineering at Arizona State University. But my thing is cold plunge therapy.
Yeah.
You live in Southern California.
Right.
And many of the aspects of the story that you've told, the endocrinologist looking at you said, you have insulin resistance. Even if your HbA1c is at 5.2, which is fine, it may be that you're maintaining healthy blood glucose levels because your pancreas is working all the harder. You might have hyperinsulinemia and normal blood glucose levels, and this would be characteristic of some insulin resistance. However, did you grow up in a warm climate?
Oh, yeah, I grew up here.
And do you seek out, I don't know, the beach, the ocean, the cold water, the cold?
Me personally?
I'm talking about you personally, Nicole.
No, I actually I want to move to Florida and live on the beach in the hot, humid weather. But that's
right. When a body, a human body comes into this world, it is, as an infant, it has so much brown fat. The brown fat is packed with mitochondria, and it is what is responsible for non-shivering thermogenesis. So ordinarily we get cold, our muscles shiver, we're familiar with that. But an infant doesn't have muscles that are developed to the state where they can shiver and keep the infant warm. So there's plenty of brown fat for non-shivering thermogenesis, where the mitochondria in those fat depots will produce heat instead of ATP. But if you don't get cold, you lose the brown fat. Up until about 15 years ago, most medical doctors thought there was no such thing as brown fat in an adult human being. It was very rare. And yet this team in Sweden, which was looking at PET scans in cancer patients, said, we think we're seeing brown fat. Sure enough, other researchers started looking at these PET scans and said, wow, in about 5% of adult sort of middle-aged cancer patients, there is active brown fat. And that means in 95%, there's no detectable brown fat at all. And it comes from a lack of cold exposure. Brown fat works with the thyroid. It is in constant communication with the thyroid. And so when you don't get any cold, you live in Florida, you live in, Southern California, live where I do in Arizona, and you lose that brown fat, you lose the essential secretory capacity of the brown fat. Brown fat produces neuroprotective factors. Brown fat will convert thyroid hormone from the inactive to the active form even better than the thyroid does. Brown fat communicates with the thyroid to control metabolism, and brown fat is associated with increased insulin sensitivity. And so in your case, we have a hypothesis that the exercise is really good for your metabolism and your cardiovascular health, but it is not a substitute for brown fat, that you have lost that essential secretory function of the brown fat because you're not in the cold. And there isn't a physician anywhere in your experience who's going to say, well, Nicole, I was listening to a YouTube video from Professor Seager, and he said you should really hop in the ocean and get some cold. It's not something that anyone is going to learn in medical school.
Yeah. There's a lot to say there. I mean, as a kid, so yes, I used to love I love the ocean. I do love the cold water. I even in here, the Pacific Ocean on our side here is quite cold. And I actually have always had a pretty good cold tolerance. I don't usually get cold, which is kind of why I know when my thyroid is sensitive, because I get cold and I'm like, I'm never cold. So I don't mind the cold. Let me preface that. But there's something to be said, and I kind of want to back up a little about the PCOS and the stressors, because you called me out. I'm gonna just say my reservation here is that I think a lot of what happened with me is, and I think a lot of moms can relate to this. There was a lot of like childhood issues and trauma that kind of stuck me in this high cortisol state. Yep. And I think part of my insulin resistance and my PCOS was really from a high insulin state, like high stress, high cortisol, which drove up my insulin. And
cortisol interferes with insulin sensitivity.
Absolutely. And I think when I dig deep, I'm like, I think that was it. It was just a lot of cortisol. And so as an adult, I'm like, how do I deal with this? Okay. So I've made it, as it were. Like, I'm married, I got 3 kids. They're in my boys are doing great. One's lost his autism diagnosis. I have a career now I'm comfortable with. So I don't have to like overcome these huge mountains. I feel like I'm going to start being in the fun part of my life, or just the cruising part. So I'm trying to decrease my cortisol. So I'm trying to just let everything go. I feel like there's an emotional, almost kind of spiritual part that I'm working on right now that really needs to be addressed for chronic health and for my chronic health. Yep. Because you can't just do diet and exercise and supplements. There has to be some emotional, spiritual work there too, in my opinion. So I guess the thing with the cold plunges is that I have this very strange relationship with hard things. So I love hard things, and I find that I crave hard things, and I will do something just because it's hard, because I'm a maniac. That's just who I am. And I'm like, oh, that's hard. Let's get it done. And I love that about myself. But at a certain point, I find that, maybe that's been part of my problem. Maybe I need to redefine who I am. Like, maybe it's okay for me not to like slam my hand in the corridor because it's hot, or because it's hard. And I don't mean that like a cold plunge is like that, but I worry. And I don't think that there's a problem when I hear people talk about cold plunges. And the literature is great, by the way. There's some really fantastic literature with mitochondrial help and cold plunge. I worry about the mentality sometimes of just like Joe Rogan said, I do it because I hate it. I do it because it's hard. And I watched that interview and I'm like, well, I don't know if I really want to like put that myself through that. I mean, I love the benefit. I love the idea. I mean, I have 3 13-year-olds. I mean, literally my husband's making them run 3 miles right now, and they hate it. And he's making them do it because he's like militant. He's like an ex-cop. I love him for this. He makes them do hard things because that's important in life. And I really value that. And yet there is a time where we need, I think it's like, I can't always be doing the hard things. Sometimes I need to take a break. Sometimes I need to just go into the sauna and like lay down and relax. Sometimes there is time for that love. So I think you need to mix the two. And so, cold plunges, for some people, it's like the David Goggins thing where it's like, I love David Goggins, but I feel like sometimes he's almost hurting himself just to be a masochist. And it's like, okay, well, I want to do the hard thing, and you're brilliant, and you have a wonderful, beautiful story. And like, are you loving yourself? Like, and is there work we need to do? Have you forgiven that like fat young boy you used to be? And because I'm a mom, I got big mom energy, so I'm always looking at the opposite end of this. Like, so are you okay? So David Goggins, can I give you a hug? So that's my thing with cold plunge. I think I want to try it. I think it can be great. I think if you come in with the right mindset, if this is good for me metabolically, I'm loving my body. I like this after effects. I think it can be really positive.
This is a complicated thing that I think a lot of people, and especially women, struggle with.
Yeah.
Men have it a little bit different. It's culturally, and it's also probably biological. Maybe it's related to testosterone. I'm going to call it dad energy and
Yeah,
mom energy, which is something
absolutely.
that you, right? And so
Absolutely.
your husband is out there. He's going to lead with challenge. If
Right.
he's a stereotypical sort of masculine dad, he's going to challenge the children first, and he's going to communicate caring second. So
Yeah.
when your children finish this 3-mile run, dad's going to be there to hug them, tell
Right.
him how proud he is of them. And, I don't know, if he were my dad, we'd go to Dairy Queen or something really
Yeah.
terrible, right?
Right.
But
Right.
to reward them after. You go to any playground in America and, there's mom watching the kids hanging off the monkey bars going, be careful. She
Mhm.
starts with caring. And
Right.
there's dad going, you can do it, son.
Right,
Starts with
right.
challenge, right? Both parents have the caring and the challenge, but the order is
Right.
rearranged.
Right.
So when it comes to women and they say, look, I've been through a lot. I know my ACEs score, or whatever it is. I know my epigenome has been altered by the traumatic experiences that I've had that give me these automatic responses that I have to constantly cognitively override lest I wind up in emotional flashback.
Right.
All this makes sense. And you say, when in my life am I going to allow myself to be good to me? This is a legitimate question. Am I gonna, eat the leftovers off the kids' plates and that's my dinner instead of sitting down and, eating the big piece of chicken or whatever it is? I don't really know what your thing is, right? But there's that moment where you say, when am I gonna allow myself to enjoy the fruits of all the hard work that I have done?
Right.
Legit. And it doesn't apply to the cold plunge. It is the first 15 to 30 seconds of the cold plunge are tough. I get it. After those 30 seconds, when the dopamine is coursing through your brain, when the norepinephrine is taken over, when the oxytocin and the vasopressin now is, altering your mood, you will say, what was I even worried about?
Yeah.
Why was I even afraid of this? And it may bring you closer to the people that you're doing it with, because all of these, neurotransmitters are acting on your brain in an involuntary way that I say is like a love potion. And you will strengthen your stress response. You will improve your psychological resilience. The one-shot studies on cortisol and cold plunge show that there's typically a cortisol spike in response to the cold plunge, unless cortisol is already chronically high. If it's already too high, the body seems to understand that you're not going to make more of it in response to the cold plunge, at least the data that I've seen.
Right.
But in the studies that go, say, 2 weeks, and people are going several times a week, these subjects no longer have that same cortisol response. They become acclimated to it, to the point where they're like, I know how to do this. This is no big deal.
Yeah.
The stress inoculation of the cold plunge, time and time again, so many people will report to me that when they go through this voluntary stress exposure, it prepares them better for all the other things or triggers that might happen in their life. The irony here is that the cold plunge is part of being good to yourself. Yeah. One woman put it to me like this. She's got 4 kids. One of them suffered severe neurodevelopmental regression and is autistic. Hundreds and hundreds of hours of behavioral therapy, even feeding therapy, to the point where, there's something off about her. She still meets some diagnostic criteria, exhibits some stimming behaviors and things like that, but she's at a mainstream high school, which is wonderful. She said she goes in to set an example for her kids because she knows the woman who comes out of the ice bath is better than the one who got in.
Yeah.
Now, she suffered from Raynaud's for the longest time. But what about your kids? How do they feel about the cold pool?
Well, they said they're going to go in. So at least my boys, my daughter, I cannot get her to commit. I'm like, I'll buy you 10 bobas. She's like, no, but I didn't even have to bribe my boys. They actually are like, that sounds cool. We'll do it for you, mama. So, and they like the cold and pools in general. They don't shy away from cold. My one son wants to move up to Flagstaff, Arizona, because he likes the cold in general.
That's great.
We call him our little park ranger. He's going to be a
Yeah.
park ranger, because he just likes the cold and snow. So, but yeah, no, we'll definitely do it. And I think they are definitely, I think they could definitely benefit. I do have a subset, like I said, I do see some kids with autism in general that have kind of PANS, like this pediatric autoimmune neuropsychiatric syndrome, like basically where they're just chronic fight or flight. And
Yep.
that may not be beneficial for them. You can see it when you look at them. They literally have retracted pupils.
Yep.
And they're just maniacs. And I probably wouldn't do that to them because usually we'll use propranolol or things that block norepinephrine. But that's not most of my patients. That's a subset.
Mhm.
But I think my kids would do just fine with it. I think they'd probably see a lot of benefit, because they're pretty chill. They're pretty happy babies.
Tell me about your son who no longer meets the diagnostic criteria.
Yeah, he's amazing. We've known it for a while, but they recently tested him again, and they kicked him out of the regional center. And then I thought, oh, that's the regional center denying him services. But then they evaled him this last year for junior high entry, and they're like, this kid's great. And he won, positivity award. He gets citizenship awards. Everybody tells me how he's a bright kid and he has a really good memory, but he's just so happy. Like, he's a very positive child. He's very social. And it's so ironic. We've seen so much gains. I cannot believe, and he was the kid that wasn't supposed to talk. He was going to be severely disabled. I couldn't have imagined this kind of outcome when they were two. If you'd have told me this was going to happen, I wouldn't have believed you. And here I am. And I have so much gratitude. I can't even tell you, like, this is why I do this for a living. And I'm on your podcast. I'm on every podcast because I'm like, this is possible. Like, holy cow. Like, this is just.
But when your son received his diagnosis, it sounds like his neurologist was saying, well, this is just the way it's going to be for the rest of his life.
Yeah.
And then you had to figure out all of these metabolic and mitochondrial therapies yourself. And then experiment with your 3 kids to see, is this working? Is this working? And is this working? And then refine that without the guidance of a neurologist, at least not at first.
Right.
In order to figure this out on your own and treat your own children to the point where you're able to recover all of their neurological milestones. And even with one child, he's lost his autism diagnosis.
Yeah. I know.
Okay.
I can't even believe it. I'm like, oh, it's so amazing. And just to say too, my other son is doing amazing. He's barely qualifies on the spectrum. He's a brilliant kid. He's testing at 9th grade reading level in 7th grade. Straight A's gen ed. He's a bright kid and he's very verbal, hyper verbal. He gets a little antisocial sometimes. So he's a little grumpy. But aside from that, his functioning is fabulous. So, but he's also 13. So he's kind of moody in general, but they're doing, and my daughter is straight A's. Literally 3 A pluses. She's top of her class. She's in honors. It really matters. Like, your kid's health is so metabolic, how well your kids are doing. And there's so much involved too. My husband is fantastic. We have a great marriage. I'm very blessed that way. So there's a lot of emotional support there. But we home cook every meal with coconut oil and ghee and organic foods. And we give them supplements. We're running on our Sunday, the day before Memorial Day. We're going to go to the water park today.
Wonderful.
It's all the things.
I love hydrotherapy.
Yeah, right. And they love the water park. Yeah. So, so it's all the things. And yes, but it's really possible. And, you got to get a team, whatever that team, professional team, family team, friend team, sport team. TACA's great organization for finding support, because it really does. I have a lot of support and it's really helpful.
Well, it brings up 2 things that make me angry. The first is, even prenatal, the women who are seeking to conceive are not getting good metabolic advice. Yes. They're like, oh, take your B vitamins, take your supplements. And I'm not saying there's anything wrong with the prenatal or the pregnancy vitamins. It's fine. But they are not getting good advice about the importance of metabolic health for conception. And that's it. They used to call it geriatric pregnancy if you were older than 35, which sounds awful. It's not like you're getting a free bus ticket or a break, from the AARP. What's geriatric about it? But the fact is that the prevalence of metabolic dysfunction is so great in this country that by the time a typical woman has hit 35, she's got some degree of insulin resistance, she's got some degree of mitochondrial dysfunction, and fertility is one of the first things to go. The same thing is true by analogy with men. Erectile dysfunction, for example, is one of the first clinical markers of metabolic dysfunction. And so fertility is falling off a cliff, just like low testosterone, because testosterone synthesis originates in the mitochondria. When the mitochondria aren't right, it's no wonder that you have low testosterone. And so we see all these fertility markers or fecundity plunging because people are not getting good metabolic advice.
Yeah.
And autism is one of the outcomes of this poor metabolic knowledge environment, of the lack of counseling or care that people need and they're not getting. So that's one. And the other is, it's not too late. That is, just because your child has an autism diagnosis does not mean that they should be consigned, to this lifetime of dependency upon the parent. There are things, you mentioned several of them nutritionally, that we can do, but there's also environmental things that we can do. Cold plunge may be one of those because it stimulates mitophagy, the removal of defective mitochondria, and mitobiogenesis, their replacement with new mitochondria. But CoQ10, folate therapy, L-carnitine. You mentioned the PQQ. There are so many things that you can do, including getting the seed oils entirely out of your children's diet, that will support the neuroplasticity that they have left, that will orient them on this more typical trajectory that could result in these happy, high-achieving social children that you have. There is nowhere near enough of that messaging going out to parents that it's not just behavioral therapy. It is metabolic therapy that will work in concert with behavioral therapy to recover all of this neurological development that's been lost.
Two big points. I mean, like I said, I would have done pregnancy different, and folic acid was a big one. I have a full belief that part of my miscarriage, and I just didn't have enough folate on board, and I really needed activated folate. I have MTHFR. I probably should have taken a couple grams at least of methylfolate, and I was taking folic acid, which actually can be counterproductive and block actual folate. And so
we should be careful about. It's a distinction that Richard Fry is very careful to make. And I might have been sloppy in my terms, but will you remind us of that distinction?
Yes. So there's several different forms. So folic acid is synthetically made and it's inactive in the body. It essentially almost blocks the downstream effects of folate. So it stops production. And folinic acid, which is what we give to treat cerebral folate deficiency, is active, but it doesn't have the methyl group attached. So it's kind of this natural but unactivated folate. And then methylfolate is the fully active folate with methyl group attached to it, fully active, ready to go. So depending on folate receptor antibodies, and then depending on MTHFR status, we can give a kind of a blend of different folate and methylation support. So I needed both. I have both. So that was probably a big deal. And I wish someone would explain this to me. Folic acid has to go in the trash can. I mean, it just needs to go.
Yep.
Like, it's not good for anybody ever. Why are we putting it in the cereal? Holy cow.
Right.
I mean, this needs to just go. I mean, and the pregnancy things, I mean, I now know, because when I test myself, I have low zinc. I could have really learned, you mentioned testosterone. Zinc is strongly correlated with testosterone production. You want to bump up testosterone. Zinc is a first good place to look. So I probably, I definitely would have helped my hormone genesis by it, because I'm always low in zinc, so I take now. But just simple things that I could have done during my pregnancy that I would love to. I actually do preconception strategies, and I've done talks about this, what you can take, what you can eliminate from your body prior to getting pregnant. So that's a whole category that I've talked about. And so absolutely, I'm on board with you. It needs to start with the moms, because I mean, I know it started with me, so, and it's not my fault. I don't blame myself, but,
no, it's not.
But because I didn't know, and nobody knows. So how do you can't be responsible for
That's
Well,
why
but
we're
your
doing the
doctor's telling you the
podcast.
wrong thing, and if you don't know how, how on earth are you supposed to know? So,
Correct.
and yes, your second point is super well taken. I mean, there's always things you can do, and even in adulthood, I've seen, I mean, so many people in their 20s improve with autism. I mean, with the correct supports. I mean, it's never too late. I mean, if you can have a stroke in your 60s and recover your speech, if you can have a stroke, recover your walking again, there's absolutely no reason why you can't recover your brain if you find the right triggers, get rid of the right toxins, optimize the mitochondria. I mean, there's certain genetics. I mean, there's a certain point where we do a whole genome sequencing to see, hey, maybe there's some wonky gene that's there and we need to address that. But yeah, I believe that everybody can make improvements. I mean, I think that's 100%. Now, how much, I don't know, but absolutely, and so why wouldn't you? I mean, this is we got one life, you got one body, you got one shot at this living thing. I mean, if you believe that, so it's like, let's do this, let's live it up, be healthy, be happy, be motivated, have good mitochondria. Because when your mitochondria are on point, you're just ready to go. You're ready to live. You're ready to make relationships and have fun and take that job and do this. I mean, I see so many people that they're just not well. And I just don't think they're not metabolically well. I look at them, I'm like, man, oh man, do you need some better, diet and supplements and maybe cold plunges and, you need to do hard things and, climb that mountain.
You don't even need a blood sample assay. You can go to, any public place in America. You walk down the airport, and you see the people around you and the food that is available there and what they're eating. And you go, oh my gosh, we are in a metabolic crisis in this country.
No wonder nobody's revolting and nobody's fighting back and nobody's saying anything about anything. They're not well enough to look around and go, what the heck is all this? I don't want to be poisoned. What's in my water? What's in my air? What's in my food? I mean, we should all be, a little bit unruly. I love being unruly. That's I'm Italian. It's my nature.
A little bit.
I'm a little unruly. And I love that, because gosh, I mean, like I said, we get one life and I'd much rather go against the grain because that's, I don't know, because it's our lives and we're supposed to.
I'm going to go where the data takes me.
Yes.
I'm going to go where my data takes me.
Yeah.
I think having Kennedy as the Secretary of Health and Human Services is great.
Right.
I'm almost done with Marty McAree's book, Blind Spots. And having him direct the Food and Drug Administration is great. Yeah. I trust Jay Bhattacharya because I know Jay Bhattacharya. And thank God he's accepted this position at the NIH because I wouldn't want it. And so I'm very happy about the people that we now have in charge of our institutions of public health. Yeah. And I want to run my life where it doesn't matter. I don't care who the president is. I don't care who the director of the NIH is. The only way we're going to make America healthy again is when Americans make themselves healthy again. Yes. So MyHa is way more important than MAHA.
Right. Yep. I totally agree. It has to start with you. It's like, I can't control everything with the politics. I'm not a politician, but I certainly can control what I do, how I live my life, how my kids live their lives. And I'm trying to extend that sphere a little bit, how I practice medicine. Maybe I can help my patients. Maybe I can do podcasts. Maybe I can expose more people to it. Maybe I can expand the edges of my sphere of control, but you got to start here and you got to start small and then you got to move your way out. And, and exactly. And I think it's such a great time to be alive. I mean, everybody's like, oh, this is so scary. I'm like, it's fantastic. Like, we're actually talking about these things for, a White House official document. I mean, it's amazing. I've been waiting for this. We've all been waiting for this for so long and we're alive right now. And and I'm like, let's get on board. Where's that train?
Do it.
I want a ticket. Give me several. I'm going to give you my friend.
On the bus.
Pass them out. Get some bus.
I got to ask you one more question because I would be remiss if I didn't. Tell me about magnesium and the mitochondria.
Yeah. So I know that it is essential for several cofactors. It is basically one of the most deficient minerals we have. I find that in clinical practice, again, this is where my wheelhouse, because I'm not a PhD again. So I am a clinician and a mom. So typically magnesium glycinate is a fabulous supplement. It helps with fatigue. You'd actually think it's calming, which is great, but it actually does help with fatigue. It can help with stimming. It can help with that hyperactivity you see, help with sleep, help with constipation, maybe by helping partially the mitochondria, but also by drawing in, water and osmotic laxative. So it's probably omega-3 and magnesium are probably my two kind of go-to supplements initially, just everybody can do it. It's really safe. So even if you're watching this, it's a thing you can try with your kids. Magnesium, like I said, glycinate is really good because it has the glycine attached to it, and glycine has its own kind of, mitochondrial health and whatnot, supports. But there are other forms too. So, you can use citrate for constipation, magnesium citrate, magnesium oxide. Some people like magnesium threonate for neuroprotection, but you really can't, magnesium malate, you can't go wrong. It's a supplement that I take it every night. My kids take it every night. And like I said, and you can test for it. We do it serum to see where your levels are at. Yeah, no, it's amazing. Like I said, it's very useful.
I don't trust blood serum magnesium testing because only 1% of the total body burden of magnesium is actually stored in the blood. And so
Right.
you're missing 99% of what you're looking for.
Yeah.
However, I do trust magnesium supplements because you mentioned there is no downside. Like,
Right.
just make sure you're getting too much. Magnesium will let you know.
Right. That's true.
If you get the loose stools and the diarrhea, you might just want to back off a little bit. But it is so essential to metabolic function, to mitochondrial function, that, as you said, anyone listening to this can pick a magnesium supplement and start with it.
Yeah, no, it's fabulous. Absolutely. It's really hard, like you had mentioned, to overdose. I mean, obviously talk to your doctor, because I can't give medical advice over a podcast, but yes, it is very hard to overdose. I mean, that is actually why we test the serum levels, because some parents so we actually don't test it for being low. Ironically, we test it to see how much are we giving, because you can see those magnesium levels start to go up in the serum. And that's when you can kind of look at, okay, well, because at a certain point you don't want to throw off the balance of the calcium and the potassium too. But it takes a lot of magnesium to do that. Like 1,000.
That makes a ton of sense.
Whatnot.
Last question. Suppose I'm writing a research proposal to the NIH.
Yeah.
What's the thing that you wish you knew that we don't know yet?
Oh, gosh, that's a good question. What do I wish I knew about autism specifically?
Yep.
I don't know the one thing we knew. Well, I have a lot of theories. I mean, the gender thing always bothers me. Now, there's a lot of gender. Whenever I've asked anybody, clinicians, they throw out the estrogen is neuroprotective. Okay, I get that. But it's super male bias. And I think that saying estrogen is protective is simplistic. So I would like to look at that, because that may actually help us with the etiology of autism, and so that's always been a big question in my mind. I haven't heard a really solid explanation metabolically. But I don't know. I mean, we know so much. I mean, I am not a big fan. I mean, what I want them to do is just stop making profits off of the toxins that they put in there. I like the glyphosate bothers me so much. The pesticides, there's so much that needs not to be in there. I mean, I'd rather not have questions, and I'd rather have an argument, because I don't understand how some people can honestly live with just this knowledge, what they're doing to the American people, and how we are just metabolically not well. I mean, there's so much we do know that we could start there. And if we just eliminated those things, and that's what Maha's trying to do, and I get that, and that's perfect. There's some things he left out that are critical, like the Tylenol, I think, is in there. But he's trying his best. And if we take all that out and we live a life the way that we're supposed to live, like, it may just go away. I mean, maybe not it's going to be perfect, but then we won't have to ask questions. I mean, I think we have more answers at this point than we're implementing the answers than we do, then we need more questions at this point.
You are so right.
Yeah.
We will listen to our public health officials, and we will listen to other people say, well, we need more research. Well, we still have questions. And it presents as a barrier to action.
Yes.
We know enough to
Yes.
start acting now.
Yes.
All these graphs that show the exponential increase, at the rate we're going, every child in America is going to have 2 autism diagnoses by the time they're 3. These graphs have to come back down.
Yes.
And we know enough to bring them down.
Right.
I think it's a wonderful scientific question.
Yeah.
Why are boys more often diagnosed than girls?
Right.
I don't buy this idea that girls are better at masking their autistic behaviors or some crap like that.
Yeah.
I think there's something fundamental biomolecular that explains this, and I want to know what it is. We know that boys' brains and girls' brains develop differently. So let's take a look at some of that. And as a scientist, I would enjoy understanding it better. And if that is an impediment to action, then I'm not interested.
Right. Right. So yeah, I mean, I'm glad you agree with me. Yeah, that we need, I think we need less questions at this point, and we need more action. I think we're in the action phase now.
Thank you, Nicole. Let's do that.
Perfect.
Thanks for joining me. This has been a wonderful conversation. I can't wait to publish it.
Thank you. I appreciate you. Have a good Memorial Day weekend. Have fun tomorrow.
Yeah, and you too.